know, your life can change in the blink of an eye. 1 minute, everything is fine, and then suddenly you're trying to figure out how to pick up all the pieces and put everything back together.
Oh yeah, and that's what happened last summer to the doctors at Dmvchiropractic in Salisbury when a lightning strike destroyed their office. Fast forward 1 year. The practice is back. In fact, it's back stronger than ever and ready to help others get their back and the rest of their body back on track.
The destruction left to Dmvchiropractic in August of 2013 probably could not have been prevented.
There was a thunderstorm, and from what the fire marshals had determined, there was an electrical charge. Lightning had struck, and I don't exactly understand all the engineering behind it, but they found the location of the fire, and it had melted out some copper, so it got to 2,000 degrees Celsius.
And a major blow to Dr. Daniel Lane.
There's a great deal of shock at first because you know, it's your life's work, and it just wasn't there anymore, you know. And when we showed up, it had hit a main water line, so it wasn't just like smoke and fire. I mean, there was water dumping out everywhere. It looked like something out of a movie.
But eventually, the focus was shifted to rebuilding.
We had an opportunity where we could expand and purchase the unit next to us, and so even though we would have rather held off on that for a few more years. It's not too often when you have such an opportunity to project growth over the next 10 or 20 years. So we thought, well, let's take advantage of it.
So Dr. Lane spent the next year creating the practice of the future, one that puts the patient first.
They come check in, and there's a doorway for checking in, and it's on the same side as the desk checking in, so people aren't crossing paths. We have a nice, big, wonderful waiting room, initial waiting room. That's there just for, you know, everyone, a communal atmosphere. It's supposed to be relaxing. And then they go into their first version of therapy where we do intersegmental traction. From there they come into almost a step-down unit, a secondary waiting room, if you will. And that's very small, and that's right in front of the doctor's rooms. So as we finish up with one patient, we leave the room, our next patient's right there. They come directly in, and then they're sent to the back of the clinic for whatever form of rehabilitation and other therapeutic exercises that they're going to need.
And along the way, the patients are treated with the latest, most technically advanced equipment, like this laser used for tissue rehabilitation, cell stimulation, and healing.
What we're going to do is we're going to do a little laser therapy today. And so what you'll feel is you'll feel a little warming in this area. I'm going to glide across it with the laser applicator, and you'll feel just a little warming there. You and I will wear glasses to protect our eyes through this treatment. And what you'll feel is a little bit of warming as I treat. You should feel a deep penetrating warmth in this area. But what we're doing is we're applying light, focused of a specific wavelength to the tissue to promote an anti-inflammatory effect and to reduce your pain. Typically, most patients will feel better right away. It takes about 10 minutes to do this treatment, and I treat an area about the size of a 3x5 playing card.
See, that's what it's supposed to do. You see the strength?
But Dr. Lane admits it's not just the state-of-the-art equipment that leads to healing, it's the integration of several therapies.
What we try to do, particularly in this practice, is look at the patient as an entire being. And, you know, what are their stress levels? What is their nutrition? How well are they eating or drinking? How well are they sleeping? What are their relationships like? You know, there's a lot more to it than that. And then we can get into, you know, how does this all flow together? What systems might this be affecting? Is this just a musculoskeletal complaint? Is there a nervous system application to this? Is this structural? Might they need some exercises, rehabilitative therapy? Might they need orthotics? Or is there something else going on that's causing tone of the muscles to be exaggerated or inhibited? And then how can we go from there?
Once a therapy is determined, Dr. Lane says treatment can be administered in as few as 2 or 3 visits, getting patients back on track and pain-free in no time.
And the doctors at Dmvchiropractic have advanced training and specializations in sports chiropractic, chiropractic neurology, as well as concussion and traumatic brain injury.